further ado, I move on to the first presentation. It is my pleasure and honor to introduce Dr. Chandrima Paul, who is an internationally renowned expert in the field of glaucoma. She is a fellow of the Royal College of Surgeons of Glasgow and completed her PhD in ophthalmology with the subspecialty of glaucoma. She is presently the director and consultant of BBI Foundation Hospital, West Bengal, and she is the honorary general secretary of the GSI as well as the honorary president of the Kolkata Academy of Ophthalmology. It is my pleasure to invite Dr. Chandrima Paul to give her talk.
Thank you very much, Dr. Shubhranshu, for those kind words. And can I right away share my screen?
Sure, ma'am.
Okay, so thank you, Dr. Shubhranshu, once again for having me in your course. And in the next few minutes, I'm going to take you through writing a review article and meta-analysis. So I'd like to start on a very positive note. Those of you who haven't written yet, start writing. Those of you who are writing, start reviewing and doing meta-analyses, because your point of view creates your reality. That's the only place where your reality remains even after you in the sands of time. So hierarchy of research designs and levels of scientific evidence. So if you have a look at this, clinical practice guidelines and meta-analysis and systemic reviews actually secondary, pre-appraised or filtered studies. So these are when you actually do filtered studies, and the rest of these are all primary studies. And so today we are going to concentrate in my talk on meta-analysis and systemic reviews. So as the diagram is self-explanatory, you review literature, you actually combine it and pick up the points and make a systemic review. And meta-analysis actually is a part of systemic review itself. So literature review is a survey of previously published research on a topic, involves reading the selected text in detail and other related texts to present a fair and reasonable evaluation. So difference between a research article and a review article. Viewpoints are different. This is actually, you bring out in a review article the positive criticism of the other authors. The content is assessing already published content, which is not new content like a research article. And the length depends on the word limit provided by the journal where you want to submit for a research article. But in a review article, it tends to be much shorter. And sometimes it's an invited article, so you would be given the word limit. So review article objective is to provide a critical evaluation of the data available from existing studies and can identify new potential research areas and sometimes draw new conclusions. Other considerations would be to provide a comprehensive foundation on the topic, explain current state of knowledge, highlight the main methodologies and research technologies. So if you look at that PRISMA statement, a 27-item checklist for review articles, we start with the title, identify the article, move on to the structured summary, write a structured summary, including as applicable background, objectives, data sources, study eligibility, etc. Then on the introduction, you have two parts. You have the rationale and the objectives. The rationale is to explain the rationale for the review, and the objective is to provide an explicit statement of questions which are being addressed with reference to participants. Then you have the rest, like indicate protocol and registration, indicate if a review protocol exists, eligibility criteria, specify study characteristics, sources of information, survey, study selection, data collection process, data items, risks of bias in the individual studies, summary measures, synthesis of outcomes, risk of bias across studies, and additional analyses. So to come to the results, study selection. So given the number of studies screened, assessed by eligibility, study characteristics, as I also mentioned before, you've got to mention the study size and the method of the study, risk of bias within the study, if it is present, result of individual studies, each one of them that you've reviewed, synthesis of results, risk of bias across the studies, and additional analyses. In the discussion is the summary of evidence, summarize the main findings, including the strength of evidence, limitations, discuss limitations of the studies that you reviewed, and conclusion is providing a general interpretation of the results in the context of other evidences and implications of future. Funding, well, that is completely individualized, where you take your funding from. So structure of a systemic review, introduction, methods, results, and discussion. And I just went through these. So steps of a systemic review, again, formulation of researchable questions, disclosure of studies, evaluation of its quality, and synthesis. So review article checklist is complete this checklist before you submit your review article. Have you checked the journal's aim and scope? Have you refined the scope of your article? Did you use multiple search engines? Have you written a descriptive title and abstract using keywords? Did you start with an overview of the topic? Have you presented a critical discussion? Have you included future suggestions for your research in your conclusion? And have you asked a friend to do a final spell and grammar check before you submit it? So to summarize, should be a balanced discussion and evaluation of the strengths, weaknesses, and notable features of the text. If you're doing a criticism, it has to be a very positive criticism rather than a negative one. And if you, again, doing a negative criticism, then you have to bring out the positives from that criticism. So we're moving on to meta-analysis, which refers to analysis of analyses. And the history is was by Carl Pearson. And the first meta-analysis assessed the effect of the therapeutic intervention was published in 1955. So meta-analysis is actually, it is a part basically of the systemic analysis and is a statistical procedure for the synthesis of the results. Several independent studies must be combinable. And meta-analysis is an observational study of the evidence, and you have to have your study 1, study 2, study 3, study 4 should be of the same category. You cannot compare apples and oranges. You've got to compare apples of the same type. So meta-analysis is actually systemic reviews, which gives you the statistical strength of the whole thing, leaving out the bias. You have to actually filter systemic reviews to get the meta-analysis. So the Potsdam International Consultation for Meta-Analysis at Systemic Review, the application of scientific strategies that limit bias to the systemic assembly, critical appraisal, and synthesis of all relevant studies on a specific topic, and meta-analysis, a quantitative overview, a systemic review that employs statistical methods to combine and summarize the results of several studies. So if you again compare systemic review and meta-analysis, I told you right in the beginning, actually, meta-analysis takes its base from systemic review, and it actually gives you the statistical summary of the systemic review. So basic steps involved in meta-analysis: specify objectives, specify inclusion and exclusion criteria, literature search, under which comes the quality assessment and the data collection, sensitivity to analysis, to testing for bias, analysis of the outcome, and finally your conclusion and recommendations. So application of meta-analysis is investigation of adverse effects, new indications for existing therapies, selection from among several alternative therapies. And summary of the principles would be: meta-analysis should be carefully planned with a detailed written protocol, prior eligibility criteria for inclusion, and a thorough search for such studies. The graphical display of results from individual studies on a common scale is an important intermediate step, allowing examination of degree of heterogeneity between studies, and different statistical methods exist for combining the data. And a thorough sensitivity analysis is essential to assess the robustness of combined estimates to different assumptions and inclusion criteria. So standard outcome measures, I've actually gone through them, but this just individual results are expressed in a standard form. If the endpoint is continuous, for example, if you're talking about blood pressure, the mean difference between the treatment and the control groups is used. So, and in the endpoint is binary, for example, disease versus no disease. So it can't be dead versus alive that way. And statistical methods for calculation, overall effect. The last step consists in calculating the overall effect of combining the data, and method used for meta-analysis uses a weighted average of the results, in which the larger trials have more influence than the smaller ones. So two types of models are used: fixed effect model and random effect model. Fixed effect model assumes that the effect size in meta-analysis differ only because of sampling error, and they all share a common mean, provides a weighted average of the series of studies. And in random effects, it's a random effect model. We assume two components of variation: sampling variation, as in our fixed effect model assumption, and sample and random variation because of the effect size. So the advantages of meta-analysis are: results can be generated to a larger population, and the precision and accuracy of estimates can be given. there's a consistency of the results across the studies. Hypothesis testing can be applied on summary estimates. Moderators can be included to explain variations between study, and the presence of publication bias can be investigated. And it has its limitations as well. It has a high chance of being perceptible to publication bias. Publication bias here can be done purposefully or manipulative results by an accident through unconsciously knowing that it is being done and be unaware of it. And poor designs are also mixed with good ones, which can actually skew the statistical result. So badly conducted meta-analysis may be biased. Other than selection bias can be avoided if the basic principles are followed. And then the Cochrane collaboration, this actually international network of individuals of institutions were formed in 1993. And this is actually a library where you can check up and they regularly update you regarding what's actually going on. So steps for systemic review and meta-analysis: define clearly the questions to be formulated, search all reliable studies addressing the question in different sources, select the studies by means of clear inclusion and exclusion criteria, and evaluate the quality of this result. Extract data from each study and display them clearly, evaluate heterogeneity among the studies, calculate the result of each study, estimating diagnostic accuracy, assess the effect of variation in study validity on the estimate of diagnostic accuracy, interpret the result, assessing how much of the review or meta-analysis can be generated according to the patient's characteristics. So basically, again, I come back to my second slide, which I showed you, that systemic reviews in it do have meta-analyses. Certain portions overlap between meta-analysis and systemic reviews, but meta-analysis is largely a part of the systemic reviews, a smaller part of the systemic reviews. So tips to help summarize meta-analysis and systemic review: one should be careful of meta-analysis that do not opt for a clear and systemic procedure to select and identify the studies that need to be included in your analysis. While creating a systemic review, label or title one should concentrate on the question you want to answer. There is not a necessity to restrict your study to only numerical data, which can be meta-analyzed, and define and mention your analysis plan well before you begin. One should be clear in reporting their methods to keep on the right track. One should follow the proper reporting guidelines like standards, as I told you, PRISMA and MESSER. So I'd like to leave you with the thought that research is creating new knowledge. So please do spend some of your time in doing